Good evening, everyone. On the behalf of Team Dentist Channel Online, I would like to extend a very warm welcome to all of you. I'm Dr. Aditi Mishra, and I'll be the host for today's session on the topic Hair Transplant Surgery by Dr. Pragati. So, before starting with the session, I have few housekeeping notes to make. If you have any doubts during the session, you can put your questions in the question and answer box, and we'll be taking up at the end of the session. And if you have joined us from Facebook and YouTube Live, you can ask us questions by commenting, and we'll be answering them at the end of the session. So, without further ado, I would like to introduce our today's speaker to everyone. Dr. Pragati Naval is the practicing cosmetic and maxillofacial and hair transplant surgeon. Since 9 years, she has been into clinical practice. Currently, she is practicing pan India. She is a passionate doctor with extensive experience in maxillofacial and hair transplant surgery. Bringing forth an empathic and professional attitude, she is committed to provide patients with best care possible. She is experienced in counseling patients on preventive care and positive lifestyles too. She is specialized in hair transplant surgeries, PRP therapy, and mesiotherapy. She has conducted a lot of webinars related to surgical topics in her specialty and also other health related awareness. Welcome, Dr. Pragati.
Thank you so much. And good evening, everyone. Thank you for such a wonderful introduction, Doc, first of all. And it is my pleasure to give this webinar on this platform. Thank you, Dentist Channel Online, for giving me this stage to share my expertise, actually. And so today's webinar topic, without any delay, I can start, right? Yeah. Yeah. So today's topic is on a very forgotten branch and a very advanced in the aesthetic side, that is the hair transplant surgery. Just to mention, it will be a introductory webinar only because we are planning to conduct a workshop on the same topic. So, in detail, I'll be taking in the workshop only. So this will be an introductory session in which you will get a gist about what the hair transplant surgery actually is. Okay, so and at the end of the webinar, there will be a small quiz. I've prepared like for about 5 questions. So you can, answer them. I'll be just screen sharing the slide. Yeah. Okay. So today's topic, that is hair transplant surgery. What we'll be covering in today's webinar is the introduction, like what the surgery is about, what is hair follicle, the stages of the hair growth we'll be seeing in detail, the causes of baldness, why this condition arises, first of all. Now, what is DHT and its effects? You must have heard about the term, DHT. So what it is basically, the indications, contraindications of the surgery, the facts about the transplant surgery, and the techniques. Just an introduction of the techniques, what it is, okay? So let's start with the introduction. Now, what is hair transplant? A hair transplant is a procedure in which the hair transplant surgeon moves the hair to a bald area of the head. The surgeon usually moves the hair from the back or side of the head to the front or top of the head. Okay, so you must have seen that the male pattern baldness, okay, it commonly arises in the front. So what the surgeon does, he or she removes the hair from the back or the side because that is the strongest part of our scalp. Okay, and the hairs are shifted. So basically the position is changed. Okay, the number of hair on the scalp remains the same. Now, what is hair follicle? What is the structure of the hair follicle basically? So a hair follicle is a stalk-like structure that contains cells and connective tissue and surrounds the root of the hair. So this is the root. Okay, this is the root and it surrounds the root of the hair. So this whole thing is the hair follicle. It exists within the dermis and the epidermis. That is the top 2 layers of the skin. So this basically the skin of a scalp is composed of 7 layers. Okay, below it is the bone and below it is the brain. So many times, people are having this query that doing such a transplant surgery would not affect my brain, doctor, right? So it is very much, away. We are working on a very superficial level. That is only the first two layers are affected. So the hair follicle is basically all these things, the cells, the connective tissue, the root of the hair. So all this unit, the entire unit is called as the hair follicle. Now, how many hairs are there in a follicle? So the group of hairs are called follicular units. Okay. So like this is this complete thing you can see in the picture is the hair follicle. And this one group, two group, these are the follicular units. Okay. This might come as a surprise to those who assume that, the follicle is composed of only one hair. Okay, it's not the case. In fact, less than 20% contain a single hair. Most of the follicular units contains 2 or 3 hair. So here you can see there are 3 roots. Okay, here there are 2 roots. Mostly there are 2 or 3 roots. Very less proportion there are single roots. And a small proportion contains, even in cases where the donor is very good, so they might contain 4 or 5 units. So this entire thing composed of the root, the connective tissue and the cells is called as the follicle. Okay. Now let's see about the stages of the hair growth. So each and every hair is composed of a hair cycle. There is a hair cycle for each and every hair. Okay. So there are 4 stages. That is the anagen, catagen, telogen, and exogen. Okay. So basically anagen. What is anagen? This is the healthy state. This is the growing state of the hair follicle. Okay. The catagen is the transition phase. Okay. So the hair stops growing in the transition phase and becomes detached from the base. You can see in the picture clearly, the hair follicle is getting detached from the base. It usually lasts for 10 to 20 days. The telogen is the resting phase. So the resting phase lasts for approximately 3 to 6 months. That is 100 days approximately. Okay. You need the cells and the connective tissue to grow. So they are in a rest period. Okay. The exogen is the shedding phase of the hair follicle. Okay, it is a shedding phase. So losing actually 50 to 100 strands a day is completely normal. But when you're losing the hair and the hairs are not getting transformed, or in the anagen phase, the single hair is not coming back in the anagen phase, that times it is termed as the hair loss. So you need to understand there is a difference between hair fall and hair loss. Hair fall, like 50 to 100 strands, is completely normal, but the hairs are not going back again in the anagen phase. That time we face conditions like hair loss. Okay. Now, what are the causes of baldness? Why this condition happens? Why we lose a hair? So the male pattern baldness, I have highlighted the term the male because it is more common in the male. Okay, male pattern baldness is responsible for majority of the hair loss, and it is coming down to genetics. Like 80% it is because of the genetics in males. The remaining causes are due to variety of factors. Now, what are these factors? Like diet. Like normally we feel that we are having very nutritious diet, but then also when we do our checkups, there will be some mineral or vitamin deficiencies. So you need to check what is deficient in your body. So in cases of hair loss, the doctors always suggest go for a like vitamin testing or mineral testing, zinc, iron deficiency, omega-3 fatty acids. So many things are responsible for the hair loss. Stress is a major factor because everything is connected internally again. Then illness, any major illness the patient is going through, like chemotherapy, heavy medicines the doctor prescribes, or some radiations. So there can be hair loss due to these factors also. Or postpartum also, in pregnancy, women usually faces hair loss. Hormonal imbalances, this is more common in women, so this can be a factor. As I said, medications, certain heavy medications can lead to hair loss, but mostly these conditions are reversible. So that reversible hair loss is termed as telogen effluvium. It is a reversible kind of hair loss. But then again, if the hair loss, the hairs which are gone are not coming back to the anagen phase, it results in hair loss. Okay, so that is termed as androgenic alopecia. That is due to genetic factor. The hair loss is occurring. Okay. Now we'll see what is DHT first of all. It is dihydrotestosterone. So how it is derived? you must be very familiar with the term, DHT. So DHT is derived from the testosterone. Testosterone is a hormone present in both men and women. There is a misconception that testosterone is present only in men. No, it is not the case. The level of testosterone in males is more. That's why the condition, that is male pattern baldness, is more common in males. Okay. So men typically have more testosterone. About 10% of the testosterone in all adults, it is converted to DHT because of an enzyme, that is 5-alpha reductase. So when this enzyme in the body increases, the testosterone gets converted to DHT. And what does DHT do? The DHT gets blocked, it gets collected in the roots, and it blocks the blood supply to a single follicle. And that's how the hair starts shrinking, and then ultimately it results in hair loss. Okay. So firstly, whenever you are doing any treatment or therapy, you need to remove this blockage, basically DHT. Okay, now we'll see some of the stages of male pattern baldness and the female pattern baldness. Okay, the theory behind, as I said, like why the hair loss and the hair fall occurs is the same in both males and the females. The pattern of baldness differs. Okay, so like on the screen, you can see stage 1 and stage 2. Okay, there might be slight recession in the frontal region, right? But these stages usually get treated with some non-surgical therapies like PRP, that is platelet-rich plasma therapy, mesotherapy, and like that, derma roller. So we do such non-surgical therapies. Okay. In stage 3, the recession is more inwards, like V shape in the front line. Stage 4, you can see balding in the crown area also. Stage 5, clear-cut balding in the crown area and plus recession in the front line, hairline. Stage 6 is an advanced. So stage 6, 7 is an advanced stage. Okay. So in these cases, like you have to, completely assess the donor area. If the donor area is not healthy, donor is the back of the head from where the grafts will be extracted. If that is not healthy, so in those cases, transplant is not possible. That is the thing, because you cannot, share your roots. You need to have a strong, healthy donor area for the transplant to occur. Okay, this is the female pattern baldness. So as you can see, the pattern of baldness in the females is from the middle. Okay, so the partition increases. That's how, but it is very rare. Usually in females, you'll see thinning and dryness and frizziness. That is because of the hormonal issues. So yes, the pattern differs. Okay, so now let's have a look on the indications and the contraindications of the hair transplant surgery. Okay, so what are the indications? Like in which cases you will go for a hair transplant surgery? So men with male pattern baldness, clear-cut case of a surgery, women with thinning hair, and in those cases where baldness is apparent, like a clear-cut, area you can see, there is no thinning present, but a clear-cut bald area. Anyone who has lost some hair from the burn or scalp injury, transplant cases are possible. Only the growth may be a little delayed in such cases, or it is not that much guaranteed. That's the only thing. Okay, now let's have a look on the contraindications. In which cases the transplant surgery is contraindicated? So it isn't a good option for women with widespread pattern of hair loss throughout the scalp. As I said, there is thinning present overall, but there is no clear-cut bald area. So in those cases, you won't be doing a transplant. You won't be putting a graft on the already present thin hair. Okay. So in those cases, it is a dicey case. People who don't have enough donor hair sites, like stage 6 and 7, they don't have the donor area for the transplant to happen. So in those cases, obviously it is contraindicated. People who form keloid scar. So there is a thick fibrous scar after injury or surgery in the donor area or over the recipient area. So in those cases, it is avoided. People whose hair loss is due to medication, such as chemotherapy. So in cases like, because of the medication, because it is a reversible thing most of the time. So in those cases, don't jump in on the surgery part. Okay, so wait and watch is indicated actually. So now what are the facts you should be aware of in transplant cases? So hair that are planted are 100% natural because it is your own scalp hair. Okay, so it is nothing artificial we are going to implant. That is 100% natural what we are implanting. It grows faster than your other hair on top because it is removed from the glandular hair area. So this is the glandular hair area, the back of the head. Okay, that is the strongest part of our scalp. So these are prone to the receptors, the DHT receptors. They are resistant to the receptors. So the growth is more. The hair on the sides and the back always grows faster than the hair on the top. So that is the whole theory behind it. Even if you shave off the hair, it regrows because we have planted the root and not just the hair. So it will behave like your natural hair only. You can cut, trim, style, whatever you want after the surgery. Okay. And most importantly, hair we plant are permanent. So there is no there is no end time, like till when the transplanted hair will be there on my head. These are some of the queries the patients ask. So you have to explain them that they will behave like your own natural hair. Only thing, the way you maintain, the longer it will stay. That is the thing. Now, let's see about the techniques. What are the two main techniques used in the hair transplant surgery? So the two main techniques which are used to obtain follicles for transplantation are the FUT and the FUE. Okay, you must be aware of these terms. FUT is the strip method. So in FUT, the surgeon will use a scalpel to cut out a strip of the scalp from behind, back of the head. The incision typically is several inches longer, then it is closed with stitches. But you will, see a scar. A scar is formed after the incision is closed, and it is more surgical, more bleeding, chances of bleeding, and it is more invasive than the FUE. Okay, so there are very specific indications in going for the FUT. What is FUE? That is follicular unit extraction method. So the hair follicles are cut out directly from the back of the hair. That is one by one, the hairs are, plucked from behind through like hundreds to thousands of tiny punch incisions. So punch incisions are made and then the hairs are extracted one by one. So in random pattern only, the grafts are extracted from behind so that when the donor heals, there will be no patch formation. That is the thing. Okay. So yes, this was one of my case actually. You can see a vast difference. Obviously, it makes a difference. This was a hairline and the crown case. Okay, like I told, we people are planning a workshop on the same topic. So because, covering this huge topic in this webinar is out of the domain. So what you can expect in the workshop, if you're really interested in taking, this aesthetic course, and so what you can expect is the introduction to the transplant surgery. I'll be, briefing you out in detail what the surgery is, the armamentarium used, so what all tools are used and their significance, the hairline designing and the marking. It is a very important step. Then only, you can proceed for the surgery. The anesthesia, what anesthesia will be using. Generally, local anesthesia is sufficient. Most of the surgeries, like hair transplant surgeries, are done under local anesthesia only in the clinic. It is a daycare procedure. Types of techniques, as I told about the FUT and the FUE in detail, we'll be discussing. Detailed step-by-step procedure of the hair transplant surgery, we'll be going through that. The post-operative care to be taken after the surgery, we'll be taking that. The medications, what all medications do you prescribe? So no lifelong medicine the patient has to take actually. Only a 5-day antibiotic and a painkiller course, that is sufficient to prevent any kind of an infection. That is the only thing. The non-surgical therapies apart from surgery. So in cases where, the surgery is contraindicated, like in females, if there is thinning present, obviously you won't be going for a transplant surgery. Or in cases where the donor is not there. So what to do? So we'll be talking about the systems and the, non-surgical therapies like PRP, mesotherapy, derma roller, etc. We'll be looking after some clinical case discussion. We'll be taking that thing, and a question answer session will be following. Thank you so much, Dentist Channel Online, for giving me this platform to share my expertise. Thank you all for joining in and giving your time. Dr. Aditi, I'll be just posting the link in the chat box actually. They can, just solve those 5 questions. So I'll be, I'll come to know how much they have understood actually.
Sure. I request all the participants to kindly click on the link which Dr. Pragati is providing on the chat
I'll
box
first
and
stop the share screening actually.
yeah, and answer the questions which are mentioned there, so that we get an idea that we are coming up with a workshop on hair transplant surgery, which can be one new dimension to your dentistry career.
Just a minute. Yeah, just a minute. I have posted the link, Doc.
The link is only for the host and panelists. Can you make it for everyone? Can you again post it by marking it for everyone?
Just a minute. Okay. Everyone. Yeah. Okay, this is fine.
So I request all the participants to kindly click on this form and attempt all the questions so that we get an idea. Okay, so before moving on to the question and answer session, I'll quickly introduce our organization to all the participants. And meanwhile, I request all the participants to kindly fill all the questions which are provided in the link. And if you have any doubts, you can put your questions in the question and answer box. So we are Dentist Channel Online with the motto Healthy Smiles and Wealthy Lives. We have come up with a brand new website, www.DentistChannel.Online. So we request you to log in to our website and get all the updates regarding everything there. So we are on Facebook, Instagram, Twitter, LinkedIn, YouTube, WhatsApp, and Telegram. And we are proud to announce that we are the first digital dental media marketing company which is catering to academic, professional, and commercial needs of dental students, practitioners, organizations, businesses, and dental industry leaders. We have conducted more than 400 national and international speaker events. We have done successful World Implant Expos. We have done more than 300 oral care videos under Save the Tooth campaign. We have done more than 700 live dental webinars till now. And being a Prime member you can avail a lot of benefits. The Prime membership subscription details have been provided in the chat box as well. And if you are subscribing to our Prime membership, so you will be getting one e-certificate which will be containing one FDA CE point, and that is only and only for the Prime members. The annual price for the membership will cost you just 799 rupees. So I request you to enroll for the subscription now. And if you're using my promo code, which is ADT100, you can avail a discount. So note this and do subscribe for the Prime membership. For all the latest updates, you need to just text your complete name on this number and you'll be added to a broadcast list. And after that, you'll be updated regarding each and every upcoming events that we have. Our sponsors, Nova Mind GmbH, they provide the innovative dental and healthcare solutions to ensure our success. They have generic implants and prosthetic solutions. If in any case you have missed out our live session, you can go back on Facebook and YouTube and watch our recorded sessions there. Even this webinar recorded session will be available on Facebook and YouTube under our channel, Dentist Channel Online. Okay. So let's quickly move to the question and answer session. We have one question from Dr. Yash Kumar Jain. Is asking regarding grade 5 treatment.
Okay. Hello. Okay, his name. Okay, thanks for your question. Regarding the grade 5 treatment, I may clarify again, as I said, you need to assess the donor area, dear. If the donor area is healthy, even if it's grade 5, we can definitely proceed for the hair transplant surgery. And again, in the middle part, especially, commonly we have seen there will be thinning present. So for those cases, you can opt for the non-surgical options like PRP, mesotherapy, etc. Yeah.
Right. So again, I hope all the participants have answered the questions which we have provided in the link. So we'll go through it and we'll very soon come up with our workshop. So stay tuned with us till then. And before wrapping up today's session, any takeaway note for our participants, Doctor?
Please, thank you. First of all, thank you, Dr. Aditi. Thank you, Dentist Channel Online, and thank you all the attendees to attend, give your time for this webinar. It was a wonderful session, and looking forward for the workshop. Yes, so that in detail we'll be able to. I'll be able to guide them and clarify their queries. In case, yeah, it's
Yes,
a wonderful thing.
absolutely.
Yeah, yeah.
Yeah.
Okay.
So I request all the participants to kindly enroll yourself for this upcoming workshop. We'll be announcing the dates very soon. Stay tuned with us. And with this, we are ending today's session. Thank you so much,
Okay,
Dr.
thank you.
Pragati, for
Thank
being
you
with
so
us.
much. Thank you so much. Yeah, thank you.
Thank you to all
Thank
the
you all.
participants for joining us. So with this, we are ending the session. Good night and have a great next week.
Yeah,
Thank you
good
so
night.
much.